So there are a lot of things besides MS that affect cognition. There are a lot of medications that affect cognition. I think Christy was talking about Dopamax, different medications that are used to treat pain. So I'm not going to go through all of these, but it's just important to note that there are a lot of medications that can affect fatigue, and so that can be something when you think you're having cognitive issues that you would want to check out. So there are other causes of fatigue, other causes of cognitive problems. And fatigue is one. So if you're really tired, you're not going to think as clearly. That's true for any of us. If you have fatigue regularly with your MS, you're probably going to have times when your thinking isn't as clear. If you're depressed, you're going to have more trouble with your thinking. When you're depressed, sometimes you're just not paying attention. You're not listening. And if you're not listening, if you're not paying attention, you're not going to get information in. And if you don't get information in, you're not going to be able to use it, and you're not going to be able to get it out. But there are other things, other conditions that cause cognitive problems. For example, hormonal changes. Women who are menopausal or perimenopausal will tell you that they don't think their brains work at all sometimes, that they lose track in mid-conversation, and that they have no idea sometimes what they're doing or why they're doing things. Pain, if you're in a lot of pain, that can really disrupt your cognition. If you're sick, if you have the flu, when you're sick, if you have a bad cold, we want you to stay home because we don't want to get what you have. But the other reason we want you to stay home is you're not functioning very well usually, because you're just, I think there's all that snot in the brain or something, I don't know what it is. But you just don't think as clearly. If you're really anxious, you're going to have cognitive problems, and you know what? If you have a glass of wine, you're going to have cognitive problems. So cognitive changes can come from all sorts of places. So, but how do you diagnose cognitive problems in MS? There are a lot of things that you can do in the doctor's office and a lot of things you can do bedside, but diagnosing cognitive problems really isn't one of them, because MS cognitive problems don't tend to show up on some of the mini mental status exams and some of the bedside exams that people do. So sometimes you can do some of that in the doctor's office, but if you really need to have a good diagnosis, you usually have to go get some specialty testings, and the people that do that are neuropsychologists or speech and language pathologists or occupational therapists. And they all do different things, but they can all deal with cognitive problems. Do you need to do this? When would you need to get a cognitive assessment? When do you really need to get all of this nailed down? Does everybody need to do that if you think you're having cognitive problems? And I think the answer is probably no, but I think that's a good discussion to have with your healthcare provider. Sometimes it really is important. So if it's an issue of disability, or if it's an issue of figuring out whether or not you can continue to do your job. Some people have jobs where you can't have a cognitive problem. Some jobs, if you're flying an airplane, you really need to pay attention all the time. At least I like that when I'm a passenger. Or if you have a job that has, if you're running a nuclear power plant, or if you're doing the statistics behind ensuring massive pension funds, you can't make a mistake. So sometimes people become disabled from cognitive changes not because they have a huge problem, but because they have a little problem and they can't have any problems in the job that they do. So when do you need to get things further assessed? I think when it's a question of disability, when it's a question of any kind of legal issues, that you probably want to get more testing done, because it's really hard. Disability or cognitive changes is something that's hard to prove, and you need testing in order usually to be able to prove that. The best way, well, not that. The best way to treat cognitive problems is to prevent them. So it's easier to stay out of trouble than get out of trouble. And the reason that we put people on disease-modifying therapies is it keeps MS out of your brain. And keeping MS out of your brain is one of the best ways to prevent cognitive problems. So disease-modifying therapies are useful. Sometimes people say to me, that they're not on disease-modifying therapies because they don't have any symptoms, except that they can't think very well. Well, that's a symptom. And disease-modifying therapies are good for that too. But what other things can you do? There's cognitive rehabilitation. Occupational therapists do that, speech and language pathologists do that, some psychologists do that. And that's just learning new thinking techniques, identifying your specific area of weakness and figuring out ways to compensate for it. Sometimes it's very helpful for people, sometimes it's not. But sometimes it's useful. But there are other kind of do-at-home techniques that you can think about doing, and I think some of these are kind of obvious. But if you know, for example, that your thinking gets more clouded when you're tired, plan to do the things that you need to do earlier in the day when you're not so tired. If you know that you kind of have trouble concentrating as the day goes on, have a basket full of tasks that you can do that don't require much thinking. Don't multitask. Don't talk on your cell phone and drive, whether you have MS or not. You probably shouldn't do that, but you really shouldn't do that if you have MS, because talking on the cell phone interferes with your driving as much as being legally intoxicated. And whatever it is that you're talking on the cell phone about, you'll forget if you're trying to drive and talk on the cell phone at the same time. But there are other kinds of things you can do, and that we don't think about doing, and particularly sometimes in an office setting, but sometimes at home too. If you live in a house with other people in it, and you have a family, you'll find, I think, occasionally that you get interrupted from time to time. At least that was my experience. So if you have something that you have to do and you have to concentrate on it, close the door. You can actually, my cell phone has, I think, I hope, it has a button where you can turn it off and on. So, so you can turn off your phone, or you can unplug the phone you have at home if you don't want to get interrupted when you're in the middle of doing things. It's a common problem with MS that people have working memory impairments, and all that means is that you don't have any hold buttons on your phone. So if you go to do something and you get interrupted, then you can't get back to it. You've forgotten what you were doing. So if you're sorting the mail and the phone rings, then you forget where you were. And so it's not a huge problem, but it can be irritating to have to go back and start everything all over again. So if you have trouble processing information because your information processing speed is just slower, when someone's giving you information, like, you can ask them to talk more slowly or to explain it again. Certainly if you have memory problems, you can write things down, and that's helpful, and you can ask other people to write things down for you. A lot of the times in families, what happens is that conversations occur on the fly. So the children will tell you something as they're heading out the door, or your spouse will tell you something as he's going through the kitchen. If you're not attending and you have some cognitive issues, if you're not attending, you're not going to get the information, and so you're not going to remember it. So you can have some rules in your family about communication like that, that you can't give me information that way because I won't remember it. And finally, see, this one took me a long time. You can ignore people. So if you're in the middle of doing something, this happened in my family quite a lot, and here's what happened. I would be downstairs at the basement with my head in a trunk in this corner of the house, and someone would be 2 flights up in this corner of the house, and they would start hollering at me. And so I would hear, so I would move out, and I would say, what? What? And I would keep moving until finally I left the basement and was up in the corner of the house. And then I was annoyed, and I'd forgotten what I was doing, and what would happen is I would be in the middle of projects, and I would never get them done because I wouldn't get back to them, so I would have what the family called pat piles all over the house, little unfinished projects. And what I learned how to do and I am embarrassed to say it took me 15 years to figure this out. When they start hollering, ignore that. Just don't answer. Because if you don't answer, eventually they start moving down and finding you, and then you don't have to do all the work. So, that's one of my favorite techniques for managing cognitive problems. Okay, so how are we doing on time? Okay, so fatigue. Fatigue occurs in, I don't know where I got this number, 78% or more of MS patients. I think it occurs in a whole lot of MS patients. It is probably one of the most troubling symptoms that people can have, and is a leading cause of disability. Fatigue, fatigue is a really irritating symptom to have, and when people have it, and they say to somebody else who doesn't have MS, I'm really tired, and inevitably the other person says who doesn't have MS, yeah, I'm really tired too. And people with MS will say, but it's not the same sort of thing. It's really not the same sort of thing. The fatigue that goes along with MS can just be, someone described it to me one time as it feels like someone took the fluid out of my spinal cord and just, so it can have different symptoms and it can manifest in different ways. So it can be a tiredness, a mental tiredness, a lack of motivation, kind of feeling down, depressed, not feeling rested after sleep is something that people frequently talk about. No stamina. There are different types of fatigue. So some people have kind of chronic fatigue all the time. And I know someone, for example, who gets fatigued every day at 1 o'clock. And it's like someone shuts her off at 1 o'clock and she needs to sleep until about 3:30. And it happens every day. Sometimes people have acute fatigue, so they're doing okay. But suddenly they just are all of a sudden really fatigued. And sometimes acute onset fatigue can be the sign of an exacerbation, actually. They're different. So fatigue can be, sometimes fatigue is just kind of a cognitive fatigue, so people don't get so much tiredness, they get brain fog. People talk about it as brain fog. They just can't think or concentrate or do things very well. Sometimes people get kind of physical fatigue. It can be, you can get fatigue, for example, if you exert yourself. So it's like you have a battery that just doesn't have much charge, so you run out of charge and you have to stop and plug yourself back in. It's kind of a short-circuiting fatigue. Sometimes people have just an overall general exhaustion, that kind of lassitude that comes with MS. So MS fatigue comes on easily, often without warning, and it keeps you from doing sustained activity. It's made worse by the heat. A lot of autoimmune diseases have fatigue as a symptom, but MS is, I think, unique because it's made worse by heat. Fatigue can appear early in the disease. It can be a presenting symptom. It isn't related to your level of disability. It can be quite disabling, however. And it can affect your ability to move and your ability to think.